The 21st century market reality reveals a huge gap between school curricula and marketplace demand. While in school, graduates are expected to acquire relevant knowledge, skills, and attitudes to solve critical problems in the workplace. A staggering figure of 250 million African youths looking for work shows the potential of African economies. In Nigeria, future problem solvers, change agents, and drivers of social businesses are in great need of entrepreneurship training within the education system curriculum. The University Co-Creation Hub, U-COHUB, is a university-fit ideation program designed to turn university undergraduates into skilled providers of solutions for social and real-life problems, with provisions for mentoring, acquisition of leadership and global competitiveness skills, and technical training. The project supports creativity, entrepreneurship, and innovation, and thus provides opportunities for university undergraduates to develop and showcase innovative ideas for social impact.
The University of Medical Sciences in Ondo has a philosophy that revolves around the issue of innovation and entrepreneurship. I do believe that in the 21st century, life revolves around not just following what things have been, but addressing things in new ways and preparing young graduates who are equipped, who are competent, who are being oriented to being able to address the challenges of their time. I'll be able to take on the challenges of the future.
Students who succeed in this program will possess relevant employability skills and be able to create jobs via innovative solutions or as entrepreneurs.
I want to encourage our students. I know our students well. They are young people with great mind, with great innovation, with great sense of mission. I just want to encourage them. This is an opportunity you must not miss. Please seize it with all your heart and make sure we impact the world the way we can.
For inquiries, call +234 7066 504779 or visit www.ucohub.org. U-COHUB, raising a community of problem solvers.
Okay, so good evening, everyone, and you're welcome tonight. You're welcome to tonight's amazing session, and we can't wait to have you guys here. Please remember to tell your friends, tell other fellows who are not here yet that the program is about to start. And today we are blessed to have a mentor, a leader, and an advocate for entrepreneurship and job creation in the building. And the mentor is already here in the building. We're just waiting for the student to join. Tonight I'll be hosting you, and I'll be having a co-host. My name is Sojime Gbowon, and I'll be hosting you on tonight's edition of the Medical Entrepreneurship Fellowship virtual training program. Remember, this is your platform. Please remember to tell your friends to join this session. We're about to start now. I think Mr. Dubilawa is in the building. Please over to you, Mr. Dubilawa. Good evening, everyone, and I welcome you to the night meeting. God bless you.
All right, good evening, everyone. It's another session today, and we are so excited that we'll be doing this, especially with Dr. Jackson tonight. But then, before Dr. Jackson comes up, here are the ground rules for this virtual session. In an event, you want to ask a question, kindly use the hand raised icon. So it means when you want to ask a question, just tap the icon. Then secondly, you have to mute your speaker in the course of the session. Please kindly mute your speaker in the course of the session. Make sure your background is not noisy, and anytime you have a question, just jot it down, and when it is time for question and answer, you can ask your question. I will be introducing the speaker, but before introducing the speaker, I would like to read our speaker's biography. So we are so, in the course of reading the speaker's biography, you would realize that we are so lucky and honored to have Dr. Jackson with us. So Dr. Jackson is an experienced life coach with over 15 years of experience in human capital development initiative. He holds an honorary doctorate degree award in learning and development from Miles Leadership University, and a Master of Science degree in project management from Lagos State University, the 2014 Future African Leaders Award, and lots more. With joy in our hearts and with gladness, dear fellows, distinguished fellows, let us welcome Dr. Jackson.
Hi, good evening, everyone, and it's a privilege to be here. Thank you so much, Mr. Sojit. We call you Village Tisa, which you could be Village Teacher, but it's Tisa that we have. Thank you so much for all that you do with your team. Thank you so much, Emmanuel. It was nice seeing you again. Thank you for all the work you do. I can see Dr. Adewale here. Good evening again, and congratulations to all the Medical Fellowship, Medical Entrepreneurship Fellowship Fellow. Congratulations to all that you do, especially with the work with the U-COHUB. Good to be here. So we're going to be looking at design thinking. Let me see how I could share my slide and then we can get to work. Can see my screen. Do let me know. Can anyone see my screen?
Yes, I can see it, sir.
Oh, good. So whose voice was that? Whose voice was that?
A fellow. That's a fellow.
Oh, okay. I want to know her name.
Ezekiel Ayomide, sir.
Ezekiel. All right, nice. Okay, so Ezekiel, so we're going to do this class together. Thanks so much for always responding. So my name is Dr. Samuel Jackson, and we're going to be looking at design thinking in healthcare. It's going to be very interactive. Wonu discussion I had with Mrs. Wonu at the time was quite short. So we're going to start and then we'll see how much we would go into it. So design thinking in healthcare, design thinking has come to stay. We're just going to look at the agenda. Let me just go through it so that you just look at the agenda that we'll be looking at. So we're going to be looking at what is design thinking, why is design thinking important. Then we're also going to look at design thinking in healthcare. We'll look at a case study together, and then we can have some Q&A. All right, so let us start. So what is design thinking? Jayola, when you hear design thinking, what came to your mind? You want to help me? What came to your mind when you heard the word design thinking? Oh, design. Okay, great. Design. That's great. Design is a very good word. Very good word, design. Okay, Benga. You hear design thinking, what comes to your mind, Benga? We need to be very interactive. If you want to speak out, you could wave your hand and then we would allow you to talk. Grace, Irene. Let's make it okay. I see a hand. You can go ahead and speak.
I think design what you think. Awesome.
So design what you think. Amazing. I'm going to think. Amazing. I've never even thought about that, but that was very, very amazing. Bella said to me, understand design thinking is innovative ideas and being able to leverage on it. That's to design what you think. Amazing. Irene, your hand is up. Irene, you can talk.
Good evening.
Hi, good evening.
Okay, what came to my mind when I heard design thinking is just rebranding and fashioning a certain product or a service based on the ideas you had about what your brand wants to look like. So that's what I feel. I don't want to use the word
I really,
design. That's
I get. So, fathoming, bringing to bear what you think. That's amazing. Well
thank
done. We've got a very intelligent set of people. Thank you so much, Irene. Um, Dreamland said creating through illustrations. Amazing. We are all very correct. All very correct. So bringing something to being. I love that designing what you think. Amazing. Okay, thank you so much. Okay, so let me go back to my slide, and then we'll begin to see what design thinking is all about more. Is an innovative approach to problem solving that leverages insight from the end users of new products, services, and experiences in order to develop best fit solutions that are rapidly prototyped and iteratively refined. So I'm going to take it. It's an innovative approach to problem solving that leverages insight from the end users. Most products who stand the test of time have that part of longevity when it comes more from end users. And that's why a lot of businesses suffer in Nigeria, because they are not customer centric. Businesses who do not put into place customers tend not to stay longer. And that's why design thinking brings that innovative approach where you bring a best fit solution. Most solutions are not best fit. And that's what design thinking helps you do. It brings about you, it helps you develop. If you notice, most of you have mentioned develop, fathom, design. Design thinking is more about developing a best fit solution. Very important. I remember there was one project we were doing for a community to get them water. That community lacked borehole water for years. And them down. So let's go further. So design thinking in healthcare, where we all are, is an approach that applies the principle of design thinking to solve complex problems. Complex problems that will improve the overall patient experience, healthcare delivery, and medical innovation. And if you check the work at the U-COHUB, what we've been trying to do is to build your capacity, build your competencies, and build your capability to be able to creatively bring up innovative solutions. And that's why this topic comes very timely now. So being able to think through a design in healthcare with design thinking will improve overall patient experience, the healthcare delivery, and medical innovation. So we're still looking at, we're channeling design thinking for the healthcare. Design thinking encourages a human-centered, iterative, process which involves understanding patient needs. So you're not part of the challenge that was held during COVID was how much of the vaccines were solutions to what people needed. So design thinking helps you to understand the needs of your patient, the challenges, and then preferences to developing innovative solutions. I love this. This was a speech that was given, that human-centered design is about meeting people where they are. When you let people participate in the design process, you find that they are often having indigenous ideas about what really would help them. And it's a big challenge in a lot of hospitals we have in Nigeria. They really do not have opportunities where you as a patient can give a feedback. I'm going to pause here and ask, how many of you have really visited an hospital where you had an opportunity to give a feedback? Who here? You were able to visit an hospital and you were able to give a feedback? Who? Anybody here? or any hospital you use, give you opportunity to give a feedback. Anyone here? Irene, have you ever?
I've never actually.
I didn't get you, Irene.
I said I've actually never. I've never
Never.
had that.
Amazing. Oh, amazing. Thank you, Irene. Jesref? Jesref, your hand is up. Have you ever had opportunity for a feedback from any hospital or any pharmacy?
Yes, like in school we do posting or diagnosis, and then we come back to give reports as exam.
Oh, amazing. Okay, so have you ever? I'm saying this because I also had opportunity to be in the hospital, and I had to give a review of their work. Have you ever been opportune to give a review of any hospital or a pharmacy or healthcare?
Yeah, the healthcare facility at a community along Ondo town, Oboto community. It's an healthcare facility there. It was even very recent. We had to give a report about it.
Okay, did you give the review to the hospital?
No, to our lecturers.
Okay, so it's a different ball game. So that means the hospital do not give room for reviews that would even help their work. So this was done in school. Okay, I really want someone to help to counter this, that if any hospital has ever asked you for a review of services you've ever done. I'm also trying to check the chat room if anyone has dropped any chat. Okay, no chat at all. Okay, so you see, part of the challenge that we have, even you yourself must use design thinking for your life, seeking feedback, and this helps your relationship, your teamwork with your friends, because you never can tell how much more you are hindering people from easily working with you when you do not get a feedback. So design thinking helps you meet people where they are. You're able to work with them, you're able to get result with them. So let's go deeper into design thinking and how that we that are medical entrepreneurs, we can use it effectively for our work. You can come up with a solution the world has never seen if you apply design thinking, if you're able to get feedbacks even in your work. All right, so why is design thinking in health important? Why is design thinking in health important in healthcare? Now, design thinking is it has a patient-centric approach where you don't just come up with a solution, and that's why we have many solutions on App Store that are not sellable because they are not people-centric. So in healthcare, you'll be able to have a patient-centric approach. Design thinking has facilitated improvement in patients, in providers, community satisfaction, and in public health. If you're able to apply design thinking in healthcare, there is so much improvement you see in patient, providers, community satisfaction, a lot of community satisfaction, and in public health. And design thinking has increased efficiency and collaboration in intervention. You see a lot of teamwork more in the use of design thinking in a lot of interventions. Of course, with design thinking, there's a whole lot of reduction in cost and waste. Why? Because there is a head-on. In project, there's what we call community entry in project, where you don't just carry out a project, you need to go to communities to even talk with palace, to even talk with Olori Ebis, to really talk with kings before you can carry out your solution. So how design thinking can be. So let's delve into it quickly. So how design thinking can be applied in healthcare. So that's what we're going to look at before we take a short break in 7 minutes. So in 7 minutes, we should be able to round it up. So number one, you empathize. That's the one thing. So we're looking at how design thinking can be applied in healthcare. So number one is empathize. And what is empathize? Empathy. You've heard the word empathy. I want to stop here to. Has anyone heard the word empathy before? Has anyone heard the word empathy? Okay, you want to talk to me, Ayomide?
It's about understanding someone. Probably you have empathy towards something, like you understand the situation.
Okay, great. Understanding the situation. Thank you so much, Ayomide. Oluwasomi, your hand is raised. Oluwasomi, your hand is raised. Okay, understanding the situation. Who else want to help me understand what empathy is? Hello?
I think it's the ability to feel what other people are feeling at a particular time.
Okay, I like that. Just you feeling what other people are feeling. Hello, you want to speak? Hello?
To me, empathy is being able to put your shoes yourself into someone else's shoes and feel what they feel.
Feeling what they feel in their shoes. Okay. Amazing. I'm giving you guys a round of applause. And finally, Dreamland. Dreamland. Okay, empathy is putting oneself in their shoes. Thank you so much, Mary. Very intelligent set of guys here. Amazing. Okay, so let's go back to our slide as we conclude the class. So first, you empathize. To empathize, so this is the first step in design thinking process, where healthcare professionals seek to understand patients' experience, the pain points and needs. And that's the best way to use design thinking. Once you want to come up with an innovative solution, you first empathize. And how do you empathize? You engage in activities like observing patients in their natural environment. You conduct interviews. You collect data to gain a deep understanding of the challenges faced by patients and healthcare providers. So you want to come up with an innovative solution in healthcare, and you want to apply design thinking. You empathize. You put yourself in their shoe. You feel, you think, you say, you do. You put yourself in their shoe, just like some of you had said. And how do you do that? You do that by conducting interviews, by asking questions. Maybe you get into a community where there is high born level of disease. Before you can think of a solution, you ask. That is empathizing. You collect data, because data is very important for every solution you want to, come up with. And then after empathizing, I'm taking my time. The next thing is you define. So after gathering insights, you define the specific problem you want to address. So let's take, for example, the people who are coming into a particular hospital do not get the kind of treatment they really need to get, or maybe a particular doctor is hostile. So you define the problem. The problem could be, how can we best solve doctors' poor attention to patients? So you have defined it. So this involves synthesizing information collected during the empathize stage to create a clear problem statement or a point of view. You must define it. You must have a brief. You must understand it. And that's what define is all about. Defining is the problem you want to address after empathizing. So after being with them, collecting data, you now define. And after defining, you now ideate. So what is the meaning of ideate? So at this stage, you start to generate ideas. After understanding their needs, after understanding the patient, the users, at this ideate stage is very critical, because here you begin to brainstorm, you begin to analyze, you begin to synthesize, you begin to look at that stage and come up with a human-centered problem statement that you want to address. And that's what ideate is. Brainstorming. coming up with possible solution. Ideating is putting ideas together. Just like someone said, design thinking is to design a thought. That was very. So here you ideate, you brainstorm and come up with ideas. After you've done that, you now come up with a prototype. Maybe sketches, diagrams, to more complex mock-ups or functional models. So the solution comes from the ideation stage. You now start bringing up prototypes. Prototypes could mean samples. Samples. What could probably I've been involved in a lot of products that were sort of some prototype. I had a friend who wanted to help young children eat well in schools, and he thought popcorn was the best, and he brought some prototype. I had the same guy had never done chips before. He was just asked by a company to do chips. He brought, but the prototype is a sample, almost the solution. That's a prototype. And once the prototype is out, you must test. Once your prototype is out, you must test. The prototypes are then tested with real patients. So the kind of solution, and that's what they did with the vaccine, the corona vaccine. They were prototypes, and then they started testing on human. We started hearing stories how vaccines became injurious to some persons, and as last week in the US, there was serious tornado to the corona the vaccines in one of the places. So they were being tested on human. Even though at some point some people said the vaccines were at the final stage, some said they were being tested. For every solution, you must test them, and you test them with real patients and healthcare providers to get feedback. In the place of testing, you get your feedbacks, you get your insights, you check to see if it was really, really valuable or not. And from there, you can begin to evaluate, to check to see how it's going. So we're going to have a case study together, and you will all provide a design thinking step to this. So this is going to be our case study. I'm going to stop here. We're supposed to have a short break by 8:30. So I'm going to stop here. And then once we come back from the water break or the coffee break, we're going to look at this. So this is the background. A large urban hospital recognized the need to improve the overall patient experience as they were receiving feedback from patients and staff about various pain points and inefficiencies in the care delivery process. The hospital decided to apply design thinking principles to tackle these challenges and create a more patient-centric healthcare environment. So these are tasks. Apply the design thinking approach to this. So this is what we're going to do together once we come back from the water break. So at this point, I just hand over to Toby or the Megbonwo, and then we'll just have
amazing session, sir. Thank you. Dr. Jackson, you have done it again. And we want to really appreciate you for this investment. We want to appreciate you for this opportunity, and we want to appreciate you for your time. Again, tonight is design thinking, and you've heard it all. Please, let's quickly work on the case study question that is being thrown out to us, and return here shortly. In another 3 minutes, we'll be returning here shortly to share our feedback from the case study question. We want to go on a short break now. Please do not go away. Today is design thinking with Dr. Samuel Jackson. Over to you, media.
The 21st century market reality reveals a huge gap between school curricula and marketplace demand. While in school, graduates are expected to acquire relevant knowledge, skills, and attitudes to solve critical problems in the workplace. A staggering figure of 250 million African youths looking for work shows the potential of African economies. In Nigeria, Future problem solvers, change agents, and drivers of social businesses are in great need of entrepreneurship training within the education system curriculum. The University Co-Creation Hub, U-COHUB, is a university-fit ideation program designed to turn university undergraduates into skilled providers of solutions for social and real-life problems, with provisions for mentoring, acquisition of leadership and global competitiveness skills, and technical training. The project supports creativity, entrepreneurship, and innovation, and thus provides opportunities for university undergraduates to develop and showcase innovative ideas for social impact.
The University of Medical Sciences in Ondo has a philosophy that revolves around issue of innovation and entrepreneurship. I do believe that in the 21st century, life revolves around not just following what things have been, but addressing things in new ways and preparing young graduates who are equipped, who are competent, who are being oriented to being able to address the challenges of their time and be able to take on the challenges of the future.
Students who succeed in this program will possess relevant employability skills and be able to create jobs via innovative solutions or as entrepreneurs.
I want to encourage our students. I know our students well. They are young people with great mind, with great innovation, with great sense of mission. I just want to encourage them. This is an opportunity you must not miss. Please seize it with all your heart and make sure we impact the world the way we can.
For inquiries, call +234 7066 504779 or visit www.ucohub.org. U-COHUB, raising a community of problem solvers.
Thank you so much for all of the impacts you cause around the world. As we call you Village Tisa, thank you so much. And thank you so much to everyone who has been contributing. Ayomide, Ezekiel, thank you. Irene, Jesref. Okay, so we're going into business now. We've heard so much about, okay, sorry if I didn't call your name, and the rest of us who have also contributed. Apologies if I couldn't call your name. All right, so we're going to go into business now to look at, to now put into use all that we have learned. I'm just going to take us back a bit, which we all looked into well. So we said the first point of design thinking is first empathizing, putting yourself in the shoes of those you want to put up the design for. And then with next step, you should define the problem. What is that thing you want to bring about that change for? And that's what we talked about, define. And then we talked about ideation, where you are able to analyze that problem statement. So you ideate through brainstorming, through synthesizing that observation and analyzing that which you looked at in the define stage, and end up with a human-centered problem statement. It has to be human-centered, and that's why the fifth industrial revolution of work has a lot to do with the human-centric part of it. We are in the fourth industrial revolution of work, where everything is all IT, and then the fifth industrial revolution has a lot to do with incubating the human center and then IT. That would be another talk for another day. But every solution that are human centered driven usually stand the test of time. I will talk about prototyping, bringing up a sample of a probable solution, and then you test. You revisit the goal, you consider the logistics, you test with people. That solution you want to bring about, you must test with people, and you continue to evaluate. So I brought up a case study, a large urban hospital they have a problem, that pain point and inefficiencies in the healthcare delivery process. Raise your hand and I could just pick you up from there. Okay, whose hand is raised? So want to help us here? Empathize. Okay, just hold on.
Okay. So I think you'll be talking to the patients.
The patient, okay?
Yes, because they're the one experiencing most of the challenges. Like they're the one that literally knows what they're facing in the hospital. Most of the healthcare practitioners, like, they just come there to do their work. The patients are the one that are there that face the challenges and all of that. So like, you are the one to talk to them. You know what they're facing, put yourself in their shoes and know the possible solution to whatever challenges they're facing.
Amazing. What about the staff? So what if some patients are overly stubborn? What about the staff? Are you going to hear from them too? The hospital staff, like the doctors, the nurses, the administrators?
Yes, of course. I'm going to hear from them.
So what will you be hearing from them?
Like the response of the patients to maybe their treatment, or however that, depending on what they are doing to the patients. How is the patient responding to this? What is the is it very effective? No, which other way can we actually go around this to make this better?
Amazing. So you're going to conduct interviews, you're going to gather data. Rev, amazing. Please, wherever you are, just give Rev a clap. Which of your best emojis can you use here? Just use your best emoji for Rev. That was amazing. I'm waiting to see your emojis. Okay, I can see. Thank you. I've used mine too. All right, Rev, thank you so much. All right, so let's go to the next one. Thank you. So let's go to the next one. So Rev has helped us to look at empathize. The next one on our core now is to define. So who would help us define? So Rev has helped to see the problem statement. He talked about how he's going to interview the patient to see what is their pain point, and then talk to the doctors at the hospital, the nurses, the administrator, to see if there is communication line between the staff and the thing. So let us define. Who would help us coin with a defining statement, a word statement on?
So if you don't mind, please, can you give the case study again?
Okay, so this is the case study. The case study is on the screen. So a large urban hospital recognized the need to improve the overall patient experience as they were receiving feedback from patient and staff about various pain points and inefficiencies in their healthcare delivery. This is from a large urban hospital. Now, the hospital decided to apply design thinking principles to tackle these challenges and create a more patient-centric healthcare environment. So we want to use design thinking to solve this. We have little time more to go. So who would help us with define? Based on the insight that has been gathered by Rev, we want to frame a problem statement. So who would help us frame a problem statement? Whose voice am I hearing? Okay, Ada, where have you been? Okay, please come up with a problem statement. Let's hear you.
Okay, so following the steps in design thinking, someone has helped, who has helped us with what it means to empathize. So now we need to define. So our definition will be based on the findings or the results from the questions or the survey conducted during the empathy section. Like, okay, first of all, it's a hospital, so I believe that their focus is patients.
Ada, hold
Yes.
on. Remember, we're going to brainstorm and ideate. What are we going to be brainstorming on? That is the define. So that's
The
where I want to
problem.
ask you, what are we going to be brainstorming? So you have to give us a problem statement.
Yeah, so that's why I said that the problem would now be based on the findings we had in the empathy section, asking, even the patients, the administrative bodies, the administrative body, the people working, doctors and all, healthcare providers. We are now going to ask for the problem. Now, this problem can actually be in two phases. It can be from the patients and it can also be from the management. So from the patients, actually, it can be that the patient is not able to fully express the way he or herself feels. It's a whole lot of things that can happen with the patients, or some patients are not truthful. Secondly, if it's coming in from the administrative block or department, which involves, admin, maybe I think this is just going to focus majorly on the caregivers and also, yes, admin. Why? Because if as a caregiver I have complained severally that, during my surgery procedures or surgical procedures, I don't actually have access to the necessary tools that I use for operations, or yes, or I can also say that, we don't have efficient drugs to meet our customer or client's needs. I can also say,
thank you so much, Ada. Thank you so much, Ada. So you've said so much. So let me help coin. There was a hand I saw earlier. Was it Ezekiel? But Ada has said so much and has covered so much. Ezekiel, I saw your hand. You want to say
Yes, sir.
something? Okay, go
Yes,
on.
I was just thinking that if we're going to coin like a problem statement, we can just say inefficiency in healthcare delivery as the problem statement.
Okay, that's very nice. Please, I want also give Ada and Ayomide your best emoji. That was very nice. Thank you so much, Ayomide and Ada. So if we put together what Ayomide and Ada said, we could say something like, how might we create a more comforting, supportive hospital experience that enhances patient engagement and reduces stress for both patients and staff? So that's how I might want to coin mine. How might we create a more comforting and supportive environment that will be stress-free and reduces stress for both patient and staff? Now, if you check what I said, it brings together what Ezekiel and Ada has said. Okay, so let's go to the next one. Ideate. Okay, someone help me. So how do you ideate? Now, Jeffrey has helped us with the problem statement. Ayomide and Ada has helped us define what we want to brainstorm on. Okay, how do you ideate? Irene, you left me. Why? Hello. How do we ideate? Someone help me quickly. We have less than 3 minutes to be done with this. How do we ideate?
I think we ideate by
Yes, Ref. Can you hold on a while? Just hold on.
Okay.
We have a lot of people in this room. We are 30. So who is helping? Olowo Yo. We have many money names here. Okay, Owo. A lot of Owo. Owo guys, we are talking now. So how do we just we want to take all our prize away today? Dreamland. Okay, Olabamiji, Bella. Okay, how do we ideate? Okay, quickly.
Okay, this is how we ideate. So we have emphasized and we have defined the problem. So what we need next is to brainstorm about the problem, because one thing about hydration is that we don't do it alone. We come with other team members, whether it's our team members or other people that we find out the problem together. So we are going to brainstorm on this idea. We come up with something that is with an innovative idea that will solve this particular problem. Then we will now end it up by analyzing the problem more so that we can.
Thank you so much, Bella. You said so much. Please use your best emoji for him. Thank you so much, Bella. I've used all emojis I can see here. Everything, I've used it for you. Thank you so much, Bella. So Bella said so much. So during the brainstorming session, the team that has now come together will generate numerous ideas to identify or to address the identified issue. And that's what Bella just talked about. And you make that solution home-like. There has to be an human. Don't forget, design thinking is all about human-centered solution. And you can come about with designing maybe digital communication platform where the patient and the staff are able to talk, and that's what some HMOs are using right now, where from the comfort of your home, like the HMO I use for my office, just from the comfort of, I remember when I had a toothache, I needed to get to see a doctor, and had needed to see the dentist. With my app, I was able to, I was referred to the closest one. So in this part of ideating, you're coming up with human-centric solution that will, empower both the staff and also empower the patient. So let's go to prototype. Okay, who is helping? Oh dear Jesus, this is 8:57. Who is helping? Okay, just read. Go on, just read. Just go on.
So I think prototype is like, after you've gotten your ideas, you have to like design something that you think is going to like fit into solving that problem. Like it doesn't have to be so accurate.
Okay, what kind of prototype, what kind of prototype will fit this kind of problem statement? So the problem statement was more of the hospital having issues with patients and staff. The level of communication is one that they cannot understand, and they are receiving the kind of feedbacks they are receiving is not good, and there is a need to improve the overall patient experience. The challenge is just the patient experience. So what kind of prototype will best fit this?
Patients are not cooperating with the doctors. Is that what you said?
Yes, the patients are complaining that the overall experience in the hospital is not so good. So the hospital wants to fix that.
I don't know, depending on the experience though, if we are going to do it individually. Okay. But totally maybe hiring new people, or maybe sitting the doctors down to like tell them how to relate to patients, or I don't know, just something that.
So I kept you on the spot though, but I like the fact that you were still able to try out a lot of things. So Mary Olafusi, Mary, you want to speak?
Good evening, sir. So I was thinking, for instance, if a doctor is not well paid, the doctor would definitely not want to give the patient the best treatment. So we should find out if they are well paid. Then if not, let's pay them better. If the workload is too much, then we can employ more doctors. And then also, at the end of treatment, we can give each patient a feedback form, so that the doctor that is not treating the patient well is like rebuked. So the doctors are conscious that the patients are monitoring them. That way, they want to give a better treatment to the patient. Thank you, sir.
Amazing, Mary. I'm feeling you. Thank you so much, Mary. Please use your best emoji for Mary. Please use the same thing for Jesse. Luku, oh finally, Luku Mono. Please speak.
I would suggest
analyzing and understanding the internal environment of the hospital, like understanding the problems before picking or thinking of the right solution, the right prototype.
Very right. You're very right. You're very right. Understanding the patient, the environment is also very key. I was also thinking that there is a problem with patient onboarding in this hospital. So if you can design a app that will help onboarding patients, that you can understand patient experience. I don't know any hospital that have a patient onboarding application. They just go, they do tests, give you injection and go. But if you have an application that can have patient experience from onboarding to the treatment to the aftercare, and this is a challenge to all of you to come up with a solution that will help hospitals, that will help onboard their patient from the day of they get into the hospital, from while the experience is on and the aftercare. Some hospitals don't even care after you've had the injection after 2 or 3 days. You know, so it's Oluwasomi, you want to say something?
Yes, sir. Yes, sir. Good evening, sir.
Good evening. Go ahead.
So, if this case is about giving feedbacks, I think maybe the hospital something can create something like websites. So, for example, now if they're having bad feedbacks, they will definitely try to improve. So, I think that's the way to solve that.
Oluwasomi, I'm also thinking the website should have a real-time communication, like a chat box that they can communicate real time. What do you think?
That would be very nice too.
Amazing. Please give Oluwasomi his best emoji. Please, that was really nice. And after all of these prototypes has been done, let's not forget you have to test. You have to test. You know, test this equipment with the patient, test them with the patient, test them with the staff, and then you continue to evaluate the solution. You know, very important. You continue to evaluate the solution. So I'm closing. So from this case study, one of the things that would happen is that there's going to be patient satisfaction. If this job satisfaction, there will be decreased burnout because of the staff. You heard about situations where nurses are being beaten. There was a case where a nurse was killed. With this solution, there is communication efficiency. The digital communication platform streamline patient-provider communication, and it does reduces errors and enhance care coordination. There is reduced length of stay. So with improved communication and better patient understanding, hospitals observe a reduction in the length of patient stays, and those contribute to overall cost. And of course, there is a positive brand perception for all. So you see, it's very, very important that design thinking is being put to use in all that you do as a medical entrepreneur. So you must be filled with excellence. You must be inquisitive. You must always want to see how that you want to improve on every work that you do. So on this note, I want to thank you. I don't know if you still have time for Q&A. I really want to thank you for making the class very interesting. If you have some Q&A, we could take some if we still have more time. So thank you so much, guys. You were really, really very fun to have a session with you, and I was really, really excited to have the talk with you. So on this note, I look forward. You can follow me on LinkedIn, Samuel Jackson. You can follow me on LinkedIn, and you can always have conversations together. All right, thank you so much for all of the efforts. Thank you so much, guys.
Amazing session, great session, amazing session. Thank you, Dr. Jackson. Please, before you go, sir, the students they have just requested that they would like to have a photo session with you. Please, if your hand is also busy, can you all on our cameras, and let's the cameraman quickly take a photograph on time. Ayomine is there to take the photograph. David is there to take the photograph. Let's quickly on our camera quickly. Let's start the picture section quickly, everyone. Beulah, Jesri on your camera. Adrian on your camera. Please, let's quickly on our camera and have a good photograph. Yes, thank you. Oluwasami Jayola, please on your camera. You just seen an icon on your screen. That icon that looks like a camera. Just press it, then your camera will be on. You don't need to unmute yourself, just the camera alone, so that we can really take the photograph quickly as we move on. And get set for the next session, please. Let's quickly have the cameraman, please. Over to you. Quickly take the camera and let's go. Thank you very much, everyone. Cameraman, please take the camera. Let's go to the next section. And currently now we want to launch our evaluation. We want to launch our evaluation. You know how it happens. Please, if you have not on your camera, you can on it quickly so that they can take your picture. Thank you. Thank you, Tere. Thank you, Daniel. Thank you, Moyo. Thank you, Timothy. Yeah, great one. Great one. Top of for you guys. You're doing well. Top of for you guys. Great. It's an amazing set to have Dr. Justin here. He's a very busy man, a very busy master trainer. For us to bring him down here, it's a whole lot of work, and we don't want to take this for granted. So while we move on to the evaluation section, I'm sure Mr. Rulo, you are set for the evaluation. Please launch the Kahoot now. Let us have our evaluation now, quickly. So you know how it goes. The winner will walk away with amazing prizes tonight. Let's see how much you have learned from this session. Let's see how much knowledge you've gained from this session. And let's see how you want to innovate into the medical space. We are not just training you to become a medical doctor, but you want to become a problem solver in the medical space, someone who is developing solutions that are highly destructive to solve real life challenges. The Kahoot goes now. You know how we do it? Quickly, type in the code. The code is 1784423 on your screen. Or you just bring your phone close to your device and snap the QR code there. It will launch you to Kahoot straight. It will launch you to the evaluation dashboard. You know how we do it? Yes. Thank you, everyone. Thank you, Jesri. We can see you. Thank you. We can see you. You're welcome to tonight. You're welcome to tonight evaluation. It is important for us to evaluate this session. We want to know how much you have learned from our mentor tonight. And if you don't have the app on your phone, you can easily log on to www.kahoot.it. www.kahoot.it. Kahoot is spelled as KAHOOT.it. Yeah, thank everyone. Yeah, we want to have minimum of 25. Minimum of 25, you can do it, guys. Let's go. Dream, thank you. Irene, thank you. We want to see the best student tonight. We want to see the best student tonight. The person who pays the highest attention tonight in this class, we want to see. 1 more minute, 60 seconds. Somebody said the network is very bad, and we understand that. Really, it's been very, very bad. Network is very good. I know that you can do it tonight. Let's quickly log on to Kahoot. 1 more minute to go. Yeah, here we go. We can launch now. Engineer, let's launch the Kahoot now. Thank you. Let's see the winner of that question. Thank you. The fastest finger tonight. Enoch. Congratulations, Enoch. Congratulations, Enoch. Let's move to the next question now, quickly. Congratulations. Let's see the dashboard. One. Thank you. Congratulations. Next one. Nifi, you are doing well. 1,397 score. Wow. Followed by GB. Then, we move to the next question. So fast. You're welcome. Wow. It's coming second now. This one you need to arrange it. According to the order steps in design thinking. Let's see. You need to arrange it. You need to drag and arrange it yourself. Nifi, congratulations. Wow, Nifi, right. Nifi, congratulations with 2,000. Nifi with 3,005 scores, followed by Aris. Congratulations. Next question, please. Let's go. Congratulations, followed by race, then GB. Yeah. Oh, gesture. Yeah. Followed by gesture. Let's go. Next question. Aristocrats, congratulations with 4,713 scores. Let's move to the next question quickly. Congratulations, Aristocrats. Congratulations. Let's move to the next one quickly. The second to the last question now. Nifi is back again. Nifi, congratulations. Next one. The last question now. Between Nifi, GB, and Aristocrats. Let's see the person. The fastest finger. Yeah, let's see. Drop the board now. Yes. Irene Super, congratulations. Congratulations. Ayomide, congratulations. Then the who is investing and complex. Wow. Nifty, congratulations. Congratulations, Nifty first. Please let our table record that takes note of this. Nifty came first. Ayomide came second. And Aristobas came third. Congratulations to you guys for winning tonight's challenge. So congratulations to the three of you. Nifty first, Ayomide second, and Aristos first. And this is the prize for tonight. For the third and second position, you both will receive tonight. Tonight you're going to receive 500 recharge card each. And Nifi will be going home tonight with 32 gigabyte flash drive. Nifi, congratulations! And we want to also say to everyone that have won a flash drive in the past sessions, your flash drive will be coming to you any moment from now. Please kindly reach out to our team member, Miss Wanu, sending your address, the best bus stop to get to your space, and we'll be detailing or sending it down to you in another town. And some of you who are back at home, let us know so that we can also send it to your location. You will all be receiving your item between this week and next week. Again, we want to say congratulations to everyone for making it tonight. And now we want to go into the Q&A session because our master is here tonight to take that session tonight. And we will be going to the next item on our agenda, which is closing remark, and that will be done by Mr. Tubiloba. But before we go, let's find out if we have questions on the dashboard. Before we go, let's have our video on for a short break.
The 21st century market reality reveals a huge gap between school curricula and marketplace demand. While in school, graduates are expected to acquire relevant knowledge, skills, and attitudes to solve critical problems in the workplace. A staggering figure of 250 million African youths looking for work shows the potential of African economies. In Nigeria, future problem solvers, change agents, and drivers of social businesses are in great need of entrepreneurship training within the education system curriculum. The University Co-Creation Hub, U-COHUB, is a university-fit ideation program designed to turn university undergraduates into skilled providers of solutions for social and real-life problems, with provisions for mentoring, acquisition of leadership and global competitiveness skills, and technical training. The project supports creativity, entrepreneurship, and innovation, and thus provides opportunities for university undergraduates to develop and showcase innovative ideas for social impact.
The University of Medical Sciences in Ondo has a philosophy that revolves around the issue of innovation and entrepreneurship. I do believe that in the 21st century, life revolves around not just following
around them to see. So you're not fighting it, you're empathizing with them, you're putting yourself in their shoe, and you definitely get the best result you can ever think of having. I hope that answers your question.
Yes, sir. Thank you very much, sir.
All right, thank you a lot, and congratulations again to the winners of I really was thinking Ayomide was going to come top, but I'm also excited Ayomide was part of the top 3. Congratulations to the number 1 winner.
The University Co-Creation Hub, U-COHUB, is a university-fit ideation program designed to turn university undergraduates into skilled providers of solutions for social and real-life problems, with provisions for mentoring, acquisition of leadership and global competitiveness skills, and technical training. The project supports creativity, entrepreneurship, and innovation, and thus provides opportunities for you